Hi everyone, welcome to At Home with Economics. I'm Alice Meredith, and we're here to talk about home economics as well as how politics and national economics will affect you and your family. For this first episode, we are going to be talking about what is happening in Venezuela. The UN reported in the last couple of days that there are now 4 million refugees from Venezuela that have left the country since 2015 because of the dire economic crisis there, which is just an astounding number, and it is an unbelievable humanitarian crisis. And so what we're going to dig into is the causes of that economic crisis, and why it's important that we learn lessons from Venezuela in the United States today. So there are 4 causes of the economic crisis there, and we're going to break this down into 4 videos, one for each of the policies that led to this crisis. So we're going to cover price controls, social welfare programs, currency controls, and the nationalization of industries. So to start out today, we're going to talk about price controls. So price controls are basically just what they sound like. It's a control on price. So when the government says you can't charge more than so much money for a bag of flour, for a roll of toilet paper, for a stick of butter. And this is good for poor people because it makes it cheaper to buy food, to buy, sometimes there are price controls on rent, so it'll make rent cheaper. There might be price controls on medicine. So it's good for people who don't have a whole lot of money because then they can afford things. So that sounds like a good thing. And so this is what they did in Venezuela. Under Hugo Chavez in 1999, they started price controls on things like flour, cooking oil, and toiletries, and they later expanded this to other items in the economy as well. And as we talked about, this has a short-term or immediate effect of people being able to afford things that they couldn't afford before. But let's think about this for a minute. Let's say that you're the person who makes flour and you have to spend $1 on the materials to make the flour for a bag of flour. And then the government says that you can only sell that bag of flour for 90 cents. How much longer are you going to make flour? Not very much longer, I'm going to say. So it causes loss of production. So companies stop making whatever it is that there's a price control on, which creates shortages in the country. If nobody wants to make flour because they can't make any money doing it, then there will not be any flour to be had in the country. And in Venezuela, what they did to combat this, well, first they just had shortages. But as starting in about 2003, 2004, the price of oil went up. And Venezuela is a major oil producing country. It's one of the founding members of OPEC. And so as the price of oil went up, they were able to import the products that they needed for their country to combat the loss of production. The companies that did not want to make these products anymore in Venezuela. But then in 2014, the price of oil plummeted, and Venezuela was no longer able to afford to import the flour and the cooking oil and the various things that they had previously been importing. So then there were shortages, and this is why we're hearing about things like people don't have any food to eat. There is no medicine to be had. There are no longer bandages in hospitals. There's no soap. People are eating dogs and stuff like that. That's why we're hearing stuff like that. It's because there's shortages because nobody has been producing these things because of the price controls. They couldn't make money before, and so now there's just nobody to make it. So why is it important for us here in the United States? Of course, it's important that we address that humanitarian crisis, that we address and make sure that people do in fact have food to eat there, and that that their economy stabilizes again, so that people will begin to produce those products and they can get back on their feet. But there is a lesson to be learned here for the United States, which is that price controls will lead to shortages. It happens every time. Even in the United States, we've had this happen before where, for example, rent controls in New York City have led to a shortage of apartments and housing in New York City because of those rent controls. And so leading up to the 2020 election, we're hearing a lot about single-payer healthcare, so the government paying for everybody's healthcare, and also price controls on prescriptions, that prescriptions are very expensive. In some cases, people can't get life-saving medications because they're too expensive for them. And that's a problem that needs to be addressed. But let's take a step back of saying we need to put price controls on prescriptions, because it will lead to shortages. Single-payer healthcare is a form of price control, because like Medicare does not pay as much to doctors as insurance companies or private individuals do. They pay less. So if the government is the only person paying, that is a form of price control. And as we learned from Venezuela, price controls lead to shortages. And most of the Democratic candidates, including Bernie Sanders, Pete Buttigieg, Kamala Harris, and Elizabeth Warren, among others, are in favor of a single-payer medical system, healthcare system. It's important that we do not go down this road, because it will inevitably happen that there will be shortages. We see this in other countries where there is a rationing of healthcare, And what that means is that there is a shortage, there is not enough. So the government has to decide who gets that healthcare. So that is just indicative of the shortage that is existing. So if we do not want to have shortages in things like healthcare and prescription drugs, and we want companies to continue making prescription drugs, and especially to have them research for new prescription drugs, we need to avoid price controls on prescription drugs and a single-payer healthcare system. So that is our lesson on price controls from Venezuela, and why it's important to you. And come back tomorrow and we'll have another video where we're going to be talking about the social welfare programs and what we can learn from Venezuela from their social welfare programs. Thank you. God bless.